Next, a procedure that they commonly do for treatment of infertility is chromotubation, where the physician, he will just inject the uterus with a dye, and this dye, they will do a carbon dioxide insufflation, and this dye will have to come via the fallopian tubes and then it should enter the pelvic cavity. If there is no spillage into the pelvic cavity, then it means like there are like tubal adhesions or some blocks that are there in the fallopian tube or in the ovaries or in the interstitium. So that is being done for a tubal patency test. Then we have something called HSG, Hysterosalpingography, which is an ultrasonography of the uterus. Please, you should have the guidance code are separate, so you should have good knowledge on what are the guidance codes, because we have different codes for SIS, Saline infusion sonography, or a HSG. Though the CPTs might be the same, the radiological imaging guidance are completely different.